From the Carl Chevrolet Studios in West Des Moines, welcome to Iowa Live. I am Lou, and it's time to visit with someone you've seen on this program before. Taylor Parker is here from Concept by Iowa Hearing, and we've learned so much, Taylor, about how hearing loss happens and what some of the causes are and how to correct it. And now we're going to talk about another cause of hearing loss, which is very prominent.
It is, and let's talk a little bit real quick about how hearing just works. We'll recap that.
Okay.
So, sound hits the eardrum. Eardrum carries the signal on to the cochlea. Cochlea is that little, it looks like a little snail. It has 15,000 tiny little hairs in there. And those are what carry the signal to the brain. The brain processes what is received from the cochlea. So if we have damage inside of the cochlea, those tiny little hairs, and noise-induced hearing loss is the #1 cause of hearing loss. So if we have noise-induced, those hairs are basically just broken off.
Okay.
So think about it, since we're on TV, we'll just talk about use TV. If severe storm, something like that happens, you're watching a show, the signal will get jumbled.
Right.
You're trying to watch a show and you're trying to piece it together. That is the exact same thing that's happening to your brain all day long with an untreated hearing loss. It's getting a broken signal all the time. Your brain's trying to have to piece it together.
Yeah,
okay.
So those little hairs are like little antennas.
They are.
Yeah.
It's very, they're very, very important. So, preserving your hearing loss is much better than trying to work it from the back end. Now, when we're talking about diabetes, if you have type 1 or type 2 diabetes, you are twice as likely to have a hearing loss.
Okay.
If you're a pre-diabetic, that increases by 30%. So, and those under the age of 60 are actually at a higher risk than anyone else.
Why would that be?
And just because you're a lot younger, and you have time to, I guess, kind of maybe preserve and help with that. But when we talk about hearing loss, for years and years and years, individuals have treated hearing losses. I'm going to do it later in life. I'm going to do it when I get older. Under the age of 60 is not older. So thinking about if you are under the age of 60 and you're the highest risk, understanding if you're type 1, type 2, or pre-diabetic, treating your, treating your diabetes, but also treating your hearing loss under the age of 60 is actually one of the most important things you can do. And then, people will ask, well, how does diabetes cause
Yeah, that
hearing
was
loss?
my next question.
Yeah, and we talked about the hairs in the cochlea. When you have high glucose levels, you actually they can burn those hairs, and and having high glucose will restrict proper blood flow. Good proper blood flow is what keeps the cochlea healthy. That snail-looking device that holds the hairs, that needs to be healthy. It needs to have good, proper, good blood, good oxygen to keep those hairs healthy. When that blood flow is restricted, it actually causes damage to those hairs. So it's that understanding what my diabetes is doing, not only to the rest of my body, but what it's doing to my hearing, and and it correlates to your eyes as well, because they're the smallest vessels we have in our body.
Well, are most diabetics aware of the fact that their diabetes could cause hearing problems?
No, that's why we do these shows.
Okay.
Is to educate people on what, because we're all connected, how else it all works.
And we've talked many times with Taylor here about how hearing loss can also affect your mental state too.
Yeah, and when we talked about the signals, jumbled signal, well, your brain has to do something. Your brain has to compensate. It pulls from other areas. So the two areas that it pulls from are cognitive and balance and gait. So understanding that an untreated hearing loss, we're actually harming our brain, because our brain is what processes our hearing.
Wow.
It's not our ears. Our ears are just conductors, and a brain processes. So it's pulling from cognitive, and that's where we get into dementia and some other, mental issues with an untreated hearing loss.
All right, so you might not have known this if you have diabetes, someone in your family that has diabetes. This is something you really need to have checked out, and you have a bunch of different locations.
We do.
That you can have somebody have their hearing checked.
Yep, we've got 15 locations around the state. It's a free hearing screening.
Okay.
Any age that you are diabetic, or pre-diabetic, or type 1, type 2, doesn't matter. You should have your hearing screened. It doesn't matter what age, especially it says that under the age of 60 are the hardest hit. So understanding that it's not an age thing, that we can't put this off till later in life, that we need to treat it earlier.
All right, now if you find that you do need some enhancement to your hearing, this would just serve you as overall wellness.
It will. When we talk about mental health, we talk about, the number one health epidemic in the United States is heart disease, which correlates very strongly to diabetes. The second is actually hearing loss.
Wow.
Untreated hearing loss is the second largest in the United States. So it's a prevalent issue that we need to really take a look at seriously, but knowing our body is connected, that treating your hearing loss can help other things as well, especially your mental state.
All right, so let's connect people with your locations. This is the easiest way to find your locations, iowahearing.com. Is that?
Best way to do it, you can actually book your hearing screening right online
Right
through
there?
our website.
Okay.
You can pick the office, you can pick time, and get everything done right there on iowahearing.com.
All right, so again, if you are diabetic, you know somebody with diabetes, make sure you get your hearing checked. And yeah, if you're under 60, yeah, have that done too. It's never too soon.
It never is.
All right, great information.
Great
Thank
to
you,
see you
sir.
again.
We do appreciate it.